Introduction to Critical Appraisal. This session is just going to introduce some background to critical appraisal, describe what it is and why we do it. Sackett and Haynes, who seem to be acknowledged as the godfathers of evidence-based medicine, defined critical appraisal 15 years ago as meaning to weigh up the evidence critically, to assess its validity, closeness to the truth, and usefulness, clinical applicability. And what they meant by that is that it's equally important when we're doing critical appraisal to think about whether we believe the study is valid, whether it's as close to the truth as it can be. And to do that, we need to look at whether the researchers have used the correct methodology, the best methodology, to answer the question that their research is posing. And we also need to check that they have adhered to that methodology very closely. They've done all they can to minimize bias so that when we look at the results of the study, we can be as sure as we ever can be that their results are the truth or as close as we can get to it, and that they're not due to chance, they're not caused by biases in the study design. So that's one very important element of critical appraisal, and it tends to be the aspect of critical appraisal that most of us think of when we immediately think of critical appraisal. The usefulness or clinical ability aspect is just as important, and this means that once we've appraised an article and decided that we think it's valid, hopefully, we then need to ask ourselves, can we actually use it? So if we're looking at the clinical applicability of a study, then we'll be looking at the patients in the research and whether they closely match the patients that we deal with in our practice. We'll be looking at the intervention that's being given to them or whatever's been done with that group of patients and checking whether we can deliver that again in our own setting. We might be looking at the healthcare setting in which the intervention has been delivered and seeing whether that matches our own situation. In the context of using a piece of research for further research, such as a systematic review, we need to be looking at what the inclusion and exclusion criteria are for our systematic review. And again, often that relates to things like study design, the nature of the patients in the study, the nature of the intervention, and checking that it matches with those criteria to make sure we can actually use the study. And it's equally important to look at these two aspects, validity and applicability. A good quality piece of research still may not be useful to us, so we've got to kind of tick both those boxes to actually be able to use a piece of research that we've appraised. The three questions that you need to ask yourself when you're critically appraising pretty much any kind of study in any subject discipline really are, what are the results of the study? So are there any major bottom line results that could be summed up in a single sentence? Then we need to ask, are the results valid? So this is really to do whether we believe that the results are close to the truth. And we might also look at the precision of the results. So we might look at things like p-values or confidence intervals or numbers needed to treat to get a sense of how likely it is that we'd get similar results with our own patients. And then finally, we need to look at applicability. So will the results help locally? Will they help us to change patient care? Will they be useful in informing a guideline or a systematic review? One of the most useful resources for critical appraisal is Tricia Greenhouse's book, How to Read a Paper. It's in its 4th edition now. You can buy it from all the major academic bookshops. You can also borrow it from most medical libraries. But it began life as a series of articles in the BMJ journal, and you can access those articles from the BMJ's website at the URL that you can see on the screen. So each chapter in the book matches more or less to an article published in the BMJ, and the articles generally look at different study designs, broadly speaking. So you could just read the chapter about qualitative research or just read the chapter about appraising a systematic review. So you can just access the particular element that's most useful to you.